Welcome. Today we're delving into the complexities of neurosarcoidosis, a rare and often challenging neurological condition. We'll explore what it is, what causes it, how it affects the body, and the options available for diagnosis and management. The precise cause of sarcoidosis, and consequently neurosarcoidosis, remains elusive. Current understanding points to an immune system malfunction. It's believed that in individuals predisposed to the condition, exposure to certain environmental triggers, such as infectious agents or chemicals, can initiate an abnormal immune response. This response leads to the formation of granulomous clusters of inflammatory cells in various organs, including the brain, spinal cord, and peripheral nerves. When it occurs in the nervous system, we call it neurosarcoidosis. It is crucial to understand that this is not a contagious disease. Let's discuss the pathophysiology of neurosarcoidosis. When granulomas form in the nervous system, they disrupt the normal function of the affected tissues. These granulomas can infiltrate the brain parenchyma, leading to inflammation and swelling. They can compress cranial nerves, causing sensory or motor deficits. Granulomas can also affect the meninges, the membranes surrounding the brain and spinal cord, leading to meningitis-like symptoms. Furthermore, the formation of granulomas can disrupt the blood supply to the nervous system, causing ischemia and further damage. The specific symptoms and severity of neurosarcoidosis depend on the location and extent of granuloma formation. Neurosarcoidosis is a relatively rare condition. Sarcoidosis itself affects roughly 10-20 people per 100,000 in the United States and Europe. Neurosarcoidosis, where the nervous system is involved, occurs in an estimated 5–15% of individuals diagnosed with systemic sarcoidosis. While it can affect people of any age, race, or sex, it is more commonly diagnosed in adults between the ages of 20 and 40, and it appears to be slightly more prevalent in individuals of African descent. The signs and symptoms of neurosarcoidosis are highly variable, reflecting the diverse ways the nervous system can be affected. Common symptoms include headaches, facial weakness or numbness, often due to cranial nerve involvement, visual disturbances, seizures, cognitive impairment, and psychiatric symptoms such as depression or psychosis. Patients might also experience weakness or numbness in the limbs, gait disturbances, and bladder or bowel dysfunction if the spinal cord is involved. Because the symptoms are so varied, neurosarcoidosis can often mimic other neurological conditions, making diagnosis a complex process. Diagnosing neurosarcoidosis is a challenging process as there is no single definitive test. Diagnosis typically involves a combination of neurological examination, imaging studies, and laboratory tests. Magnetic resonance imaging, or MRI, is crucial for visualizing granulomas in the brain and spinal cord. Cerebrospinal fluid analysis, obtained through a lumbar puncture, can reveal elevated protein levels, inflammatory markers, and sometimes the presence of abnormal cells. Additionally, a biopsy of affected tissue, such as a lymph node or skin lesion, can help confirm the diagnosis of sarcoidosis. Ruling out other conditions that can mimic neurosarcoidosis, like infections or other inflammatory diseases, is essential. While there aren't distinct types of neurosarcoidosis based on pathology, it's often classified based on the location of the granulomas and the specific neurological manifestations. For example, we can talk about cranial neuropathy if it affects the cranial nerves, meningeal involvement if it involves the meninges, parenchymal disease if the granulomas are within the brain tissue itself, and spinal cord involvement when the granulomas affect the spinal cord. Differentiating these presentations helps guide targeted treatment strategies. The primary goals of treatment for neurosarcoidosis are to reduce inflammation, suppress the immune system, and manage symptoms. Corticosteroids, such as prednisone, are the mainstay of treatment to reduce inflammation. Immunosuppressant medications, like methotrexate, azathioprine, or cyclophosphamide may be used in patients who do not respond well to corticosteroids or who experience significant side effects. In some cases, biologic therapies, such as TNF-alpha inhibitors, may be considered. Supportive care, including physical therapy, occupational therapy, and pain management, is also an important aspect of managing the condition. Currently, there are no known ways to prevent sarcoidosis or neurosarcoidosis, as the exact cause is not fully understood. Since environmental factors may play a role, minimizing exposure to potential triggers, such as certain chemicals or infectious agents, might theoretically reduce the risk, but this is not definitively proven. The prognosis for neurosarcoidosis is highly variable. Some individuals experience complete or near-complete remission with treatment, while others have a chronic, relapsing, remitting course. In severe cases, neurosarcoidosis can lead to permanent neurological deficits or even death. Recent research is focused on identifying biomarkers that can help predict disease severity and treatment response. Additionally, studies are investigating novel therapeutic targets, such as specific immune pathways involved in granuloma formation. Gene expression studies, in particular, are showing some promise. Ultimately, a better understanding of the underlying mechanisms of neurosarcoidosis will pave the way for more effective and targeted treatments, leading to improved outcomes for patients.